Should I take COBRA or Medicare when I retire? Imagine this: you've just retired and your health coverage is on your mind. You might be wondering whether to stick with COBRA or switch to Medicare. Well, let's explore what each option offers and what might work best for you. When you retire and become eligible for Medicare, most people find Medicare to be the smarter choice. COBRA allows you to keep your employer's health plan for a limited time after leaving your job, usually up to 18 months. Sometimes, it can be extended to up to 36 months if certain conditions are met. But the catch is, COBRA premiums are often quite high because you pay the full cost of the plan, plus a small administrative fee. Medicare, on the other hand, provides comprehensive coverage with generally lower premiums and deductibles. If you are over 65 and not covered by a current employer's health plan, you are required to enroll in Medicare Parts A and B to avoid penalties. Part A covers hospital stays and is usually free if you have enough work credits, while Part B covers outpatient services and costs about $185 per month in 2025. If you have Medicare first and then opt for COBRA, Medicare will be your primary insurance. COBRA then acts as secondary coverage, which might cover some additional costs. But paying for both can be expensive, especially since COBRA premiums are often much higher than Medicare premiums. For example, COBRA can cost around $600 or more each month, while Medicare Part B is about $185. If you lose employer coverage before age 65, COBRA can help bridge the gap until you qualify for Medicare. But once you turn 65, enrolling in Medicare Parts A and B is generally more affordable and provides better coverage. If you are still working past 65 and have employer coverage, you might delay Medicare Part B without penalty, but COBRA is only available after employment ends. For those retiring early, before 65, COBRA or marketplace plans through the Affordable Care Act are options until you become eligible for Medicare. After 65, Medicare should be your main health coverage. It offers additional options like Medigap plans or Medicare Advantage Plans, which can help lower out-of-pocket costs and expand coverage. In most cases, once you reach age 65 and retire, enrolling in Medicare Parts A and B is the best move. COBRA is useful as a short-term solution if you retire before 65. Continuing COBRA after Medicare eligibility is usually costly and unnecessary. Always compare the costs and benefits based on your personal situation. To sum it up, use COBRA only as a temporary bridge if retiring early. Enroll in Medicare at age 65 to avoid penalties and get solid coverage. Avoid paying for both at the same time unless you have a specific reason. After enrolling in Medicare, consider additional plans like Medigap or Medicare Advantage to help with costs. Making the right choice can save you money and give you peace of mind about your health coverage in retirement.